So we are more than our genetics. Genetics makes us much of what we are, but it doesn't determine everything we are, as environmental triggers have a huge impact on autoimmune disease and thyroid disorders. These are all the environmental triggers which I could find which have been shown to cause hypo and hyperthyroid autoimmune disease. I went through all the journal articles I could find on PubMed and looked for all the medical journal articles. You could find every one of these has been linked to a trigger for autoimmune thyroid disease. Now it is interesting when I talked to you about that in the 1960s it said thyroid disorders were not common and found in medical practice. So times have changed. But it was interesting that in those days and before, the drug to treat patients who were hyperthyroid was made by Bayer, and they sold a drug called sodium bromide. The other drug for hyperthyroidism at that time and before radioiodine ablation therapy was sodium fluoride. So sodium fluoride and sodium bromide, both prescription drugs, which have been used traditionally to make someone hypothyroid, have been traditionally used, and in some places in the world are still currently used as the treatment for hyperthyroidism. So it's also interesting to note now that fluoride is in our water supply, and bromine is ubiquitous in actually even sodas. It's found in flame retardants. So all these halogens have been implicated in thyroid autoimmune disease, and I'll go more into the details later about how it does that. So another thing which I thought was interesting, that a lot of the chemicals for the production of industry and energy transportation industrial complex produces a lot of carbon dioxide. So for example, the production of coal produces a lot of carbon dioxide, rocket fuel, transportation produces a lot of carbon dioxide. And the increase of carbon dioxide released into the air increases the temperature of the earth. So for example, in Florida, they just recently found that the water temperature was 4 degrees higher than normal. So all the release of this carbon from these industrial complex increases the water temperature, and then what happens when the earth temperature gets higher, it results in things like devastating hurricanes. Well, the same thing happens with these industrial complexes. It releases other chemicals which actually slows our metabolism down. So for example, the coal industry releases mercury, and also rocket fuel releases perchlorates. Both these chemicals have shown to cause patients to have lower metabolism and hypothyroidism. Hypothyroidism causes patients' body temperature to go down. But we're not only talking about primary hypothyroidism, we're also talking about the conversion of thyroid hormones throughout the body, so the metabolic rate goes down. And what increases the metabolic rate is thyroid hormones. That's what produces ATP. When you produce ATP in the mitochondria, it releases heat. And have you ever noticed how many people have a normal body temperature now? I mean, most of your patients, it used to be considered what was normal was 98.6. Our human physiology has been going down, and our metabolic rate has been going down. So it's ironic, as the Earth's temperature is going up, the human physiology and body temperature is going down. So there's antibodies and toxins to the 5 crucial players that produce thyroid functions. There is 5 steps to produce a thyroid hormone. So we first start off with a sodium iodide supporter, which takes iodine into the thyroid globulin. There's the thyroid globulin itself, where the enzyme thyroid peroxidase takes the iodine and then mixes it with tyrosine to make the building blocks of thyroid hormones. Then those thyroid hormones are released from the thyroid and then converted in the cells throughout the tissues of the body to the active hormone T3 for the deiodinase enzymes. And finally, the thyroid hormones have to stimulate the nuclear receptor sites of the cells to stimulate the production of ATP in the mitochondria. So there's really 5 major steps in how to make a thyroid hormone and look at thyroid metabolism. The toxins in our environment and the antibodies against the thyroid have been found in every single step of this pathway. So I'm going to go into detail about this and what we can do to change it. So just a quick review of the first step, which I'm going to focus on right now, is the sodium iodide Symporter. The sodium iodide Symporter is a protein that takes the iodide from the blood and concentrates it. It concentrates it 20 to 50 times from the blood level into the tissue, the thyroid. This protein takes the iodide and imports it into the thyroglobulin and oxidizes it. And it oxidizes it into iodonium, which is the free radical, the oxidized iodine. That oxidized iodine is then used to make T4 and T3. That iodine with the active iodide, active iodonium, is converted through hydrogen peroxide. And that hydrogen peroxide is essential for the oxidation of the iodine into iodonium. And if the TSH stimulates the sodium iodide Symporter and there's not enough iodine, it still produces the hydrogen peroxide, which is an oxidant. And that's one reason, if there's not enough iodine, you can get an oxidative issue and you can get inflammation, and it becomes an oxidative stress in the body. The sodium iodide Symporter is where it all starts, and that is where thyroid hormone function starts. Well, now we'll look at all the things which disturb that sodium iodide Symporter. So radioactive iodine will also go into the sodium iodide Symporter. The sodium iodide Symporter does not discriminate between the halogens. It will also absorb all the halogens, whether it's radioactive or oxidized or not. It'll absorb radioactive iodine. It'll also absorb bromine, chlorine, and fluorine. The release of radioactive iodine goes into the sodium Symporter and acts as a toxin to the thyroid tissue and can lead to thyroid autoimmunity conditions and also thyroid cancer. Radioactive iodine is in the air, and it's found in higher levels and concentrations in different parts of North America. And in those areas, they found endemic levels of thyroid conditions. The sodium iodide Symporter, when it absorbs the iodine, like I mentioned, it also absorbs the radioactive iodine. But conversely, in patients who, for example, the World Health Organization recommends patients to take 50 milligrams of iodine as a preventative measure in patients who are in a nuclear fallout, because it inhibits the absorption of the radioactive iodine. So if there is any nuclear fallout in your area, the first thing was recommended is to take iodine, because it will displace the radioactive iodine from absorbing. Radioiodine is what's used to treat patients who are hyperthyroid, because it destroys the thyroid tissue. And it is recommended usually for about 2 weeks before radioiodine ablation therapy in hyperthyroid patients to avoid iodine. The reason is they don't want to competitively inhibit the absorption of the radioactive iodine. So they'll take patients to stop for 2 weeks any iodine supplements or foods which have iodine, such as seaweed or fish, in order to have the maximum amount of radioactive iodine. And once you absorb the radioiodine for hyperthyroid, it destroys the tissue, and then you become hypothyroid for life. Fortunately, with holistic medicine, there are a lot of treatment modalities which are very effective for hyperthyroidism, where you don't need to do radioiodine therapy. And with the use of radioiodine therapy, patients will become permanently hypothyroid for life, and then you have a whole host of other problems. But the other thing about radioiodine therapy for hyperthyroid patients, it absorbs in the sodium iodide Symporter, but it absorbs in all the places the sodium iodide Symporter is. The sodium iodide Symporter is not only in the thyroid. The sodium iodide Symporter is in the ovaries, in the mammary glands, in the salivary ducts, the gastric mucosa, and in the prostate. And that's why patients who've done radioiodine therapy for hyperthyroidism will often have amenorrhea for about 10 months after radioactive iodine therapy. It's a toxin, and it'll go into all those tissues, the breasts, the thyroid, all those different places. So it increased the risk of cancer and also increased the risk of other conditions, which we'll go more later. So the halogens all displace iodine and affect the absorption of iodine in the sodium iodide supporter. And as I mentioned, fluorine is used in our water supply, and chlorine, and bromine is found in a lot of different things. So one doctor who spoke at our conference had a patient who became hypothyroid, and that patient was a 15-year-old boy, and they were trying to figure out why that 15-year-old boy became hypothyroid. And they looked into the diet. The doctor looked into the diet. That person was drinking Orange Crush and Mountain Dew like every single day. And some of those sodas, like Mountain Dew and Orange Crush, they don't not only put hydrogenated vegetable oil, but they brominate it. So it's brominated hydrogenated oil, which can be enough to make someone hypothyroid. So look at what someone's eating and drinking is a very important part of the first step of treating patients with thyroid disorders. The Harvard University has done a study on the effects of fluoride in the water. And they found that in places where the fluoride level is above 4 parts per million in the water supply, the IQ of children is 7 points lower. That's tremendous. And they also found the other thing was that the one place where there's the highest amount of fluorine is in New Delhi in India. And that is consistently above 4 points per parts per million. And they noticed that in that place, 47% of children had a low level normal, on the bottom level normal of T3. And they all were diagnosed with subclinical hypothyroidism. 47% of children in India, in New Delhi. Recently, 2 years ago, the laws have changed, and now the fluoride content is a little lower in the United States based on all this research from Harvard. Perchlorates is also a halogen. It contains chlorine. It's ubiquitous. It's found in most water supplies. It's found in most seafood. It's found and it's released from rocket fuel and other energy transportation in the airplane industry. And it has the chlorine in it, which inhibits and displaces the iodine from absorption. Now we're moving on to polybrominated diphenyl ethers, which are found commonly in flame retardants. Flame retardants also started mostly being used after the 1960s. And also fluoride was just starting in the 1950s and started peaking in the 1980s. These are all things which have happened since that medical textbook describing thyroid disorders is commonly not found in practice. One thing which is often overlooked is that the sodium iodine supporter is not only in the thyroid, it's also in the ovaries. The second place of the highest concentration of iodine in a woman after the thyroid is the ovaries. And polycystic ovary syndrome has increased significantly in the last 30 years as well. And the sodium iodide supporter in polycystic ovaries will also have, when the halogens absorb into the sodium, it'll displace iodine. And iodine deficiency is one of the common symptoms and signs and indications of polycystic ovaries. And what we'll notice is that when the levels of iodine are low, it can lead to cysts, such as in polycystic ovary syndrome, and in other places, such as cysts in the thyroid and thyroid nodules, and also fibrocystic breasts. Those are all the places where the sodium iodide supporter is, and those are all the places where the halogens are such increase in the environment. So moving on to the fibrocystic breasts, it used to be called fibrocystic breast disease, but now it's become so normalized that it's called fibrocystic breast changes because it's not considered a disease, but it's been so normalized now because most women have it, but it wasn't true before. And one of the quickest and easiest ways of changing fibrocystic breasts is by simply giving the patient iodine. There's one study, even a small amount of iodine, of 5 milligrams of iodine within 3 months will decrease fibrocystic breasts in a double-blind study. But I will use 24 to 50 milligrams of iodine, and usually within 2 or 3 weeks, the fibrocystic breast is back to normal. So again, we're looking at different places where the sodium iodide supporter is, and the deficiency can end up causing cysts. The third place which we can cause cysts is thyroid disorders. So you get thyroid nodules, and the biggest thing of iodine deficiency, most extreme level of hyperplasia in the thyroid would be goiter, and goiter is iodine deficiency. So iodine deficiency in goiter is caused because when the sodium iodide Symporter absorbs the iodine, that iodine cleaves to the polyunsaturated fats and produces the compound called delta-iodolactone. And delta-iodolactone is used as a body for cellular apoptosis. And with not enough amounts of delta-iodolactone, you'll get goiter. And delta-iodolactone is now becoming really studied very heavily in medical schools and research institutions. They're finding that delta-iodolactone, if it's in a small amount, will actually lead to a whole host of other problems and increased risk of breast cancer and thyroid cancer, because delta-iodolactone is essential for apoptosis. And if there's not enough apoptosis, what it can also lead is to Hashimoto's and autoimmune diseases, because the debris in the thyroid are not being properly removed, and delta-iodolactone is essential for that. But unfortunately, with the current RDA of iodine, it's not enough to make delta-iodolactone at high enough levels. And this is one of the reasons we're having epidemic proportions of breast cancer. But it's really fascinating. If you just go on PubMed and look at the medical articles, just look at delta-iodolactone, and there'll be so much information coming out in the last couple of years about its impact on breast cancer, even in neuronal health, because the iodinated polyunsaturated fats is also helpful for the healthy phospholipids in the brain, which makes sense because thyroid hormones is essential for the myelination of the brain. So now we're moving on into the cells of the thyroid. In the cells of the thyroid are producing the building blocks of thyroid hormones such as T3 and T4, but the majority of T3 is not produced in the thyroid. And T4 is a prohormone. It is not the active hormone in terms of thyroid economy. What stimulates the mitochondria is the active T3. The T3 is converted with a deiodinase enzyme. Those deiodinase enzymes are found in the cells. So in the plasma, you might have thyroid hormones such as T4 primarily, but at the end of the day, it's how much does it go into the nuclear receptor sites, and that is primarily regulated by the conversion with a deiodinase enzyme. And once the T3 goes into the cell, then it can start stimulating all the different aspects of what thyroid physiology needs, such as the CNS development, metabolism, and cognition. But you can certainly have normal levels of T4 and T3 in the blood because the TSH in the pituitary responds to the T4 and T3 in the blood. It does not respond to the T3 levels in the cells. And this is the research that Antonio Bianco has done from Harvard Research and now at Rushing Medical School, was that he noticed that patients who are on high doses of levothyroxine, the TSH might be normal, but the amount of T3 in the cells did not reflect what was considered healthy, and the T3 levels were mostly in most patients on the low level of normal and significantly lower within the tissues itself. So the deiodinase enzyme is that third step, which I mentioned in the thyroid hormone physiology. It's what converts T4 to T3, the active hormone. So let's look at the things which increase the deiodinase enzyme. Well, exercise will triple that effect. Also, all the antioxidants and polyphenols will do that as well. Antonio Bianco, who's done this research, the endocrinologist, had found that the polyphenols such as quercetin and camphorol increased the conversion. And ultimately, that conversion is what affects the cell and the metabolic rate. So in a sense, giving people lots of blueberries and antioxidants and quercetin might be quite a good way of making patients' metabolic rate get higher and make the mitochondria produce more ATP. In some ways, it might be a more direct way than even giving people just ubiquinol or acetyl L-carnitine. The other things which also impact the thyroid hormone conversion is also heavy metals. And mercury is one of the main ones. And mercury will impact the thyroid conversion in many ways. It'll not only it'll impact the deiodinase enzyme, but because it acts as an oxidant and causes lipid peroxidation in the hepatocytes, so the thyroid deiodinase enzyme can't convert the thyroid hormone to the active hormone. So it's really important to try to get rid of the heavy metals and mercury and lead. So I'll do a urine test to look at the heavy metal content, and then although I know it's not as much in favor right now, but I would still give patients DMSA, dimercaptosuccinic acid, at 30 milligrams per kilogram body weight over a 5-day period to release these heavy metals. During that time, I'll also give patients, give them fiber to help make sure that they're able to eliminate and detoxify, and give them glutathione.